So the reality is there's a hidden force that's at play right now, and it's undermining both the health and the happiness of people that live in industrialized countries. Um, this force basically involves the stimulation of dopamine in our brains, and dopamine is the neurochemical associated with pleasure. So when dopamine is artificially stimulated, for example, in the case of drug addiction, people will use drugs to induce pleasure, but they'll have to keep using those drugs in order to avoid very uncomfortable problem with withdrawal. Kind of the hallmark of addiction is that you're using something both to induce pleasure, but then you have to keep using it to avoid real pain. And the way that it works essentially is pretty straightforward. You take chemicals, whether they be cocaine or methamphetamines, alcohol, nicotine, caffeine, etc. It stimulates the brain. The brain secretes dopamine. The dopamine induces pleasure. And it makes sense because the brain was designed to get the body to engage in behaviors that favor survival and reproduction. The problem is that brain evolved in an environment of scarcity. It didn't evolve in the environment that we're living in today. And as a consequence, we can get fooled. In fact, there are, for example, chemicals besides drugs that can also stimulate dopamine in the brain that you can actually put into food or into feed. Those chemicals include salt, oil, and sugar. Salt, oil, and sugar are not food. They're hyperconcentrated food byproducts that are added to food to stimulate dopamine production, induce a pleasurable response. And the problem with putting those chemicals in our feed is they can stimulate overfeeding. If you, for example, you put the chemicals in rodent food, they'll gain 49% of their body weight in 60 days. If you put it in the feed of birds, the birds will get so fat they can't even fly. And if you put it in the feed of humans, the humans will become overweight. And that's, in fact, why we see the obesity that we do. The salt, oil, and sugar that are put into hyperconcentrated foods make those foods significantly higher in caloric density, and as a consequence, significantly more tasty. Because, again, taste is essentially how much dopamine is secreted in the brain when the food is put in your mouth. So if you're putting hyperconcentrated foods in the mouths of humans, their brains will be highly appreciative of those foods. And then if you try to put lower caloric density in the mouths of humans, they will respond appropriately. The consequence of putting salt, oil, and sugar in the feed of humans is that 72% of people living in industrialized countries are now overweight or obese. And being overweight is not just a cosmetic issue. The fact is that when we put hyperconcentrated foods into our diet and we become obese, we're gaining fat and we're gaining visceral fat. And as we'll discuss, visceral fat essentially functions like a tumor and can be extremely detrimental in terms of our health. Once an animal or a human is caught in the pleasure trap, it's extremely difficult to get out. For example, if you're an alcoholic and you go to a inpatient program, and then you go to a 12-step program for 90 days, and you have family support, you have about an 18% chance of being successful at not drinking for a year. That means 82% of all patients will fail. If you're addicted to heroin and you go through inpatient program, you have about a 10% chance of being able to not use heroin for a year, which means that 90% of people will fail. And if you're overweight and you want to lose even a modest amount of weight, say 5% of your body weight, and sustain that 5% for 1 year, 95% will fail. The reality is you have a better chance of quitting heroin than you do losing weight and keeping it off, at least using conventional approaches. What's even more startling is if you are an individual with a BMI over 40, the chance, if you're a male, of getting down to a healthy weight and staying there is 1 in 1,290. And if you're a female, it's 1 in 667. Essentially, you have a 99.99% likelihood of failure if you're starting off with a BMI over 40 and want to lose down to a healthy weight and sustain it. And the problem with this, as I said, is this fat that you're gaining, and particularly the visceral fat, that fat that accumulates around your organs and in the belly, produces inflammatory markers. It's involved with deranged metabolic function, cardiovascular disease, high blood pressure, autoimmune diseases, type 2 diabetes, cancer. Visceral fat is hypertrophic, hyperplastic, and hypermetabolic. And as I said, you think of it like having a big tumor. If somebody said you had a multi-pound tumor in your body, it wouldn't surprise you that it would be associated with production of inflammatory products and health compromising products. But visceral fat obviously can't be easily excised like you would a tumor. Looking at it another way, if you say what percentage of American adults exhibit the 4 fundamental healthy lifestyle characteristics? So being active, not smoking, eating a, quote, healthy diet, and this was a very broad definition of healthy diet, and having the recommended body fat percentage, that is, if you're a male, being under 20% body fat, and if you're female, being under 25% body fat. So what percentage of Americans have those 4 basic health characteristics? You might be surprised to find out it's 2.7%. So 97.3% don't even meet those 4 most basic requirements. If you look at the obesity charts, you find that obesity continues to spread. We keep having to add new colors. You can see that the people at the CDC are true optimists, because even though no state has yet been able to break the 45% obesity saturation rate and get to the 50%, the CDC is so confident in Americans that they've actually put it on the chart, even though we don't yet know which state will win the competition to see who can have the highest obesity saturation in the country. But we've got some people down here in the South that are working really, really hard to achieve that goal. The fact is that 93% of all the calories that are consumed by people living in industrialized countries now come from either animal food or highly processed pleasure-trapped chemicals, so oil, salt, sugar, highly processed, hyperconcentrated food. 7% of calories come from fruits and vegetables, but 1/3 of that is potatoes, and those are mostly served as French fries and potato chips. So fruits and vegetables no longer make a statistically significant percentage of the diet of many Americans living in industrialized countries. The consequence of this obesity and the visceral fat and the inflammation that's associated with the visceral fat is that we have certain conditions that are killing people. The leading contributing causes of death in the United States are heart disease, cancer, and stroke. And we spend billions of dollars treating the consequences of heart disease, cancer, and stroke. But what we're not doing is addressing the actual causes of death, the reason people get heart disease, cancer, and stroke, which is smoking cigarettes, drinking alcohol, and eating a diet made up of highly refined carbohydrates and animal foods. Perhaps if we spent more time on the actual causes of death, we wouldn't have as many of the leading causes of death. So the things that kill most of the people that are dying in the United States, as I said, are heart disease, cancer, accidental deaths, chronic lower respiratory problems, and cerebral vascular accidents, Alzheimer's disease, diabetes, influenza, kidney disease, and suicide. And with the exception of accidents and suicide, the other conditions are all intimately associated with dietary excess. So what we're doing about it as a society is having people eat health food, olive oil and red wine, dark chocolate, coffee, coconut, diet sodas, and, Atkins paleo type diets, high protein, high fat diets. And what we should do, in my opinion, is instead of eating health food, we should focus on healthy foods. Healthy foods are fruits and vegetables, grains, legumes, nuts, and seeds, a whole plant food, SOS-free diet. SOS, of course, is the international symbol of danger, but it stands for the chemicals added to food, salt, oil, and sugar. So what's the answer? Well, the answer is diet, sleep, and exercise. Eat an exclusively whole plant food diet free from added salt, oil, and sugar. Get enough rest so you can wake spontaneously feeling refreshed. And get exercise and movement. We also recommend that people consider limiting their feeding window to 8 to 12 hours a day so that you're not eating 3 to 4 hours before you go to sleep. A health-promoting diet would include fruits and vegetables, grains, legumes, nuts, and seeds. Whole plant food, SOS-free. So modern humans have been around about 100,000 years. And in that time, for 99,800 of those years, this is the kind of food that people largely ate. And then about 200 years ago, the Industrial Revolution came along, and we changed the diet to something that looks more like this. Now, I want you to look very, very carefully and tell me if you can notice any differences. Because if you can notice the differences between the diet we ate for 99,800 years and the diet we've been eating for the last 200 years, you will have the mystery solved about why we keep getting fatter and sicker by the day. It's what we put in our mouth that's determining what's going on to our waist and hips.